very thankful for the opportunity to be here once before. I had some friends. And also 2 months ago we had the visiting of Dr. John Harvey, so everything came together. So let's have the data, and any question is very welcome to compare, contrast, and see how can we handle, globally handle the problem. First, I have to introduce you to our city. So it is a southern university, and you can appreciate the city over here. So that's São Paulo. So Curitiba is located in southern Brazil. That's very important. It's a major city, so it's the 8th biggest city in Brazil. Population almost over 2 million. And if you count the metropolitan area, would be 3.2 million people. That's very important because despite the fact that it's a major city, Curitiba is well known as a very environment-friendly city. So it was considered a few years ago as the global sustainable city, was given the award. And also for 2015, 2 or 3 weeks ago, we were again elected as the best large city in Brazil. And I have to introduce you with all of that so you don't get the wrong idea when you see the hoarders. That's just a predisponent city for hoarding. So it is a very nice European southern city. So said that. Oh, and I forgot. If you saw the picture on your right, up right, that is John Harvey. So he came to visit us. He's still a faculty here, right? But retired emeritus. And so he could enjoy the big capybaras over one of the 44 parks that we have on city limits. So the Federal University of Paraná is considered the oldest in Brazil. It's not the biggest. That's São Paulo. The vet school has 80-something years, so it was established in 1930. And our shelter medicine program was established in 2011. Still the first, was the first and still the only one through the country. So as hoarding is a mental disorder characterized by persistent attractive possession despite the value, the objective value. Also, we observe obstruction of living spaces. And the problem is that it comes with a harmful personal, family, and animal consequences. It was included as a DSM-5 as a mental disorder. So it is a disease, it is a mental disease, obsessive compulsive disease. When animals, mostly pets, come along, so worsen the situation, because then we have diseases that they may cross the species barrier, and also we have failure to provide minimum standards of animal care. Hoarders also lack perception and mostly deny the consequences of such failures. And this obsessive, and this is this obsessive effort to keep on increasing animal population is actually one of the main signs of animal hoarding. So this compromised animal welfare implies on animal suffering, abuse, and cruelty. And that was the beginning of our study. So our hypothesis at that time was, how about not clinical cases or cases, but how about the city? How can the city manage hoarders? How can we detect them early? How can we prevent them, or at least offer some help at the beginning so we don't end up rescuing hundreds of pets and trying to have new homes for them? So what we did, I worked at 2013 through 15. I worked at the city. It was a I was invited to work at the city, so we had this combined kind of a task force with the city secretary of health, environment, and social assistance. So all the complaints we received through this time, we visited one by one. So it was a huge effort to visit all the complaints received as hoarding cases, as suspicious hoarding cases. So the inclusion criteria was a local presence of object and or animal accumulation with obstruction of living spaces, mainly the cause of complaint, a history of difficulty to dispose objects or donate animals, and a lack of health standards, space, nutrition, or veterinary care. We still are working on those cases because someone could argue, since it's a mental disease, it should be a psychiatrist diagnosis, but it's very hard to get, even with the psychiatrist along, it takes a while for them to diagnose, and it could be just a clinical sign of an underlying disease or another mental disease or hoarding itself. So as results for the complaints, we were unable to find the owner, so that buys it at the beginning. Some of them we didn't find the address, and 61 out of the 226, we discharged it as the complaints were made, but they were probably animal protectors, or someone would have kind of a small animal shelter in the backyard and was confused by a hoarding case. Anyway, we had 113 confirmed cases, and extrapolating for the city, so we would have a ratio of 6.45 per 100,000 people. So that's very high. We didn't expect that many. And if we extrapolate for the 200 million population of Brazil, would give us about 12,000 hoarding cases. More than that, we were able to visit one by one of the 113 and also find if they were just object hoarders, animal hoarders, or both. So for that, it was almost a half and a half. So for animal hoarding, we had 65. So would it be a ratio of 3.7 per 100,000 people? And for object hoarding, would it be a ratio of 4.10, 4.1 per 100,000? If we put it all together, so that's a big picture of that. So 226 complaints, exactly half of it they were confirmed. We're not saying that the other ones may be, maybe not. But at least we have some idea about overlapping of hoarding and the ones with just object or animal. Also, as a result, we were able to number the animals by hoarder. This is very hard. The ones working with animal hoarding may know what I'm talking about, because it's very hard to have this connection with the hoarder, to get into the house with the hoarder, and also access their pets. But we were able to count that at least 1,000 pets, 1,000 animals were on hands of animal hoarders in Curitiba at that time. So over 700 dogs and almost 400 cats. Also, here we can appreciate the number of animals. So in black, dogs, and gray, cats. This case was a recovering case, that's why it has just one. So he had a lot of cats in the past, but it was counted as well. And we have just 2 hoarders, animal hoarders. We have just 2 animal hoarders with more than 50 dogs, but we believe that it's because once you reach more than 50 or more than 100 in a big city, urban area, the complaints are so many that you probably are going to move to the metropolitan area. So that was our feeling at that time. We were able also to locate them. So here, every dot you're seeing over the city limit is a hoarding case. There's no difference per neighborhood, so there's no predisposition, likelihood of a neighborhood. And it was a cluster. Despite of that, we had a cluster over the northern city, and this is just the downtown. So also, some people would believe, at least in Brazil, that we would have more hoarding cases in the suburbs and not downtown places, but here it showed us just the opposite. Also, the more population, the more male population, the more female and elderly population, the more likelihood of having hoarders. So that comparison, that statistical comparison, was very interesting. So we could show that the ratios are okay, that there is no other predisposition besides the increase of population. So the neighborhoods with more people, we have more hoarders. And finally, we were able to also compare the neighborhood income with hoarding cases. So here in green, the lighter, the less. So the darker, people would, this is Rios, but it's 4-to-1 the exchange now. But what matters is that it was correlated, it's very weak, 0.03, but we were able to correlate hoarding cases with low neighborhood income. As a discussion, we have here actually listed all the literature for hoarding cases, and it's being described in USA, New York, some other states, Massachusetts, Baltimore, some other comprehensive studies, then Australia, Canada, UK, and that's the first report we have over developing countries or South America or non-English-speaking countries. So it shows, like we expected, that it may be a international or global disease. In conclusion, animal and object hoarding are relatively high in Brazil, and as I showed at the beginning, we have to keep in mind that we're talking about a very, very skilled city, so it's a very, very nice, clean city, so it may be a biased study, so we should study other cities, big cities like São Paulo, Rio de Janeiro, and see if we would have the same ratio. But at least for us, the distribution followed the population patterns and was inversely and negatively related to neighborhood income. As I said, it was the first assessment of hoarding cases in Brazil. And with this data, we may be able to now really compare and contrast to other countries. We got a funding of $100,000 to work on that at the beginning 2 years ago, because it would improve the approach of the city, state, and even federal agencies. It is a big problem. It is a public health problem. And also establish a city-state or even a national public health policy for that. So we have we call one system. So we have a public health system in Brazil, and that the idea would be include that disease as part of the national health system. I'm done with the data, but I know some of you probably came, I know it's lunchtime, but came to see some hoarding cases, so I brought some one average case. So she was able to speak 3 languages, Portuguese, English, and French. But it doesn't matter, right? So she would not be able to see how harmful was her pet's life. And this is considered a kind of a medium-class neighborhood. That's the tree symbol for the state, by the way. So it was an okay neighborhood, but once you get inside, then you start seeing how much the... So it was a lone person, a lady with 65 years old. That's a second-year resident of ours, of our program, trying to get into the house. We had a cat into the house. We rescued about 10 to 12 dogs outside. I was working in the city at that time, so it made it easier for us to get into the house to get the dogs and cats out. But really, I'm very sorry that's a lunchtime. It should be some other time of the day. But it's a total lack of perception of the situation of those animals. This is a master program of a student of mine, and I would be more than happy to answer questions if I can. Thank you.